At University of Virginia Health System, we're for sharing the latest health information from top minds to keep you and your family healthy. With UVA Health System Radio, here's Melanie Cole.
Getting your child ready for surgery doesn't have to be such a scary experience, and we're offering you today some tips on how to prepare your child and yourself from UVA Pediatric Surgeon Dr. Jeffrey Gander. Welcome to the show today, Dr. Gander. So tell us a little bit about what are some of the most common concerns you hear from families before they have to have surgery for their child.
Well, hi, Melanie. How are you? And thank you very much for having me on. Happy New Year to you. But that's a great question. I hear a lot of concerns from families before surgery. One is, how is their child going to cope with being separated from them? Often for a couple hours at a time, and that's one thing they worry about. Having to say goodbye to their child when the child's taken off to the operating room. Another thing they ask often is because with surgery there's an incision, an opening of their skin in some part of their body, and they're worried about, are they going to have pain? Are they going to have pain during the surgery? And are they going to have pain after the surgery? And another thing we get asked a lot is about anesthesia. What kind of anesthesia? What are the side effects of some of the anesthesia? So things like that. Families, it's certainly understandable. I have a couple of young ones myself. It's certainly understandable to be concerned when your child's going to have an operation.
Well, as a parent myself, Dr. Gander, and I have been there, both my children have had to have surgery at some point, how do you address those concerns? Like, for example, I was worried about anesthesia myself and, how a child tolerates that anesthesia and, what's going to happen afterwards, how lethargic will they be for that day following. How do you answer? I know it's individual for each child, but how do you answer those questions that you listed?
Well, a lot of times we do, I reassure the families and that say that the anesthesiologists we have here at UVA that are going to be taking care of their children are all fellowship trained in just taking care of children. So they have a lot of experience. They're just some of the best doctors we have in the hospital. And so they're very used to taking care of premature babies who are less than a pound at birth to adolescents and even to early 20s. So they're very used to taking care of children. So that's a good thing, is that they have a lot of experience. And what they do is what helps also is that they often get a little medicine to help them to get into the operating room. So I know the anesthesiology team will because a lot of families and a lot of children are very anxious, we'll even give a little bit of something to sedate them a little bit so they can come into the operating room and be a little bit more comfortable and not be as nervous. And the reason I bring that up is because often when a child is less nervous, and they often need less anesthesia, so that it actually helps them to go to sleep a little bit easier and then actually wake up and not be quite as groggy after the operation. And that goes with the families, too, is because if the families, children, as you know, read off of the emotions of their parents, very much so. And so if a family or a parent is anxious, then the child's going to be anxious as well. And like I said, that even sometimes makes them have to have more of the anesthesia and even sometimes more medicine. But there's a lot of different types of anesthesia, and depending what type of the operation is, sometimes it can happen under just a local anesthetic where we give some medicine into the surgical incision so that they don't feel anything, so it numbs the area. And the anesthesiologist will just give them a little bit of medicine to make them nice and comfortable so they won't know what's going on. And along those lines is what I often tell families is the child's going to have no pain and going to have no memory of the operation whatsoever. Like I said, they get a little something before and makes them nice and comfortable. They go to sleep, have their operation, and oftentimes they wake up and say, oh, I didn't even realize that surgery was done already. So, I think that's certainly a common concern is about the anesthesia, but can certainly say that here they're well taken care of, those children. They're well taken care of.
Well, as far as that medication to help calm the children down, Dr. Gander, I would think the parents need that even more so than the child. What do you tell these nervous, freaked out parents? I give you so much credit working with parents as a pediatric surgeon. Dr. Gander, what do you tell the parents that they should be doing before, during, and after their child goes in for surgery?
Right. So before surgery, I tell them just to ask me as many questions as you can. Because, like you said, people are well informed. There's a lot of information. So people will often come in with some of their own concerns, some of their own anxieties about their child having an operation. So I often sit down with them, or I do sit down with them, and spend most of the visit just going over that. What are your questions about the operation? What are your concerns? And I do my best. As well as the nurses I work with very closely here at UVA, we do our best to answer those questions to kind of make them a little bit less anxious. And that morning of the surgery, I just tell them to go through their normal routine. The child, we can talk about it later, but the child's not allowed to eat anything. But have the family make sure that make sure they eat some breakfast and make sure they got a good night's rest. Because they need to be there for their child the next day. And then during the operation, what I often tell people is go out, grab a cup of coffee, go get something to eat, and read the newspaper. Oftentimes they won't be able to do that, but because they'll be so nervous. But just try not to think about it for a period of time. And then for after the operation, I'll always come find them and just go over everything. And often what I'll do is even before, I'll tell them, give them a rough estimate how long the operation's going to be, because then they can start to say, oh, well, they told me it was going to take 2 hours, so I won't be worried because it's only been an hour and a half. So at least to give them some period, something to anticipate, so that they know that there's a period of time that we're going to be in doing the operation, and they can expect to hear from us, around that time. And then for after the surgery, what to tell families is that their child will have some pain afterwards, some discomfort, and depending what type of surgery it is. Whether it's a general abdominal or operation or something on the leg or bones, the pain will be different with each procedure. But I assure them that our team, the surgery team, as well as the anesthesia team in the recovery room, will do our best to alleviate that pain and help control that pain. And so, I think with hearing all those things and just speaking with the families, and that often helps out a lot for them.
So in just the last few minutes, Dr. Gander, what can parents do or say to their children, based on a child's level of understanding of what's going to happen to them? What do we tell our children to put them at ease from all the lights and the scary people in white coats? And then why should families come to UVA Children's Hospital for their care?
Right. So what to tell them is that children are very smart, and they understand something's going on, and try to explain to them as best we can what's going on and why they need to have the procedure. And what we do in our preoperative visit, and as well as sometimes we ask the families to do, is we have certain dolls and teddy bears that have devices if they're having a feeding tube placed, or a portacath, we call it, something that goes underneath the skin to help them get medicine infused. We show them what these things look like and show them on a doll or a mannequin, so that they can at least be used to what's happening, or get an idea about that. We have a child life specialist who works with them before the operation to try to get them used to a mask sometimes that the anesthesiologist will put on for them. And then, like I said, the medicine that they get beforehand sometimes makes them nice and relaxed for when they go back to the operating room. And I always ask them what kind of music do they like to listen to. So I always try to put a little bit of music on at the beginning of the operation. Anything. I like all kinds of music, and I know all the nurses do too, and anything they want to listen to just to make them nice and calm. And we all introduce ourselves beforehand, not only to the families, but there's typically about at least six people in the operating room, so 2 surgeons, 2 anesthesiologists, and 2 nurses, and we all introduce ourselves by our first name, and then once they come back into the operating room, we reintroduce ourselves again, say, remember me, I have a mask on, but we're going to be helping take care of you. And I think all those things really often help out these children. As far as coming to UVA, I think the nice thing about here is that everyone works as a team. The kind of olden days of the surgeon is the captain of the ship are gone, and it's really everybody works together. Like I mentioned, there's usually at least 6 people in the operating room, if not sometimes more than that, all working to take care of children, and we all communicate pretty well. If someone has a concern, they bring it up to the group, and we try to do our best to do that, because our ultimate goal is for the child to be safe during the operation, and then have the operation be successful, so that whatever was wrong with them can be fixed.
Thank you so much, Dr. Jeffrey Gander. It's really great information. You're listening to UVA Health Systems Radio, and for more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening, and have a great day.